Methadone is an opioid medication used to treat pain. It is also used to treat opioid disorder as a medication-assisted treatment. Methadone is otherwise known as methadose or dolafine. Common street names include fizzies, amidone, and chocolate chip cookies. In the United States, methadone is classified as a Schedule II substance with significant potential for psychological or physical dependence. How does methadone work in the body? It's a synthetic opioid agonist that mainly targets the mu-opioid receptor in the brain. Looking back, methadone was first developed during World War II by German scientists in order to combat morphine shortage. After World War II, the amount of heroin addicts in large American cities grew at an alarming pace. During the 1950s, the death rate of those abusing methadone increased drastically. Although methadone is not recommended as a prescription painkiller for common types of pain, over 4 million prescriptions were written for methadone in 2009. The rise in its use is attributed to methadone being more affordable, especially compared to other common opioids like oxycodone. Because methadone is a prescription medication, it is typically obtained from a doctor, but it can also be purchased illegally on the streets or the internet. Methadone sold illegally online is very dangerous since it is often diluted with other harmful ingredients. Methadone is available as a pill, liquid, and injection. Many people who abuse this medication do so by snorting, smoking, or injecting the substance at higher doses than recommended. Soon after consumption, the user may experience positive feelings such as euphoria, intense pleasure, and reduction of pain. Mixing methadone with other drugs, whether they are obtained by prescription or illegally, can lead to life-threatening heart problems. These cardiac issues can range from arrhythmias to heart attacks. Looking more closely at methadone's properties, pain relief continues for about 4 to 8 hours, but the substance may stay in the user's system for over 2 days. Upon discontinuation of use, low concentrations of methadone are still stored in the body due to its slow release from various tissues. However, a user may quickly develop a dependency and start to experience withdrawals when they are not using the drug. Symptoms of withdrawals are usually present after 24 hours from the last dose of methadone. Withdrawal symptoms usually last 3 to 6 weeks, but the process can take longer for those with severe addictions. Symptoms of methadone withdrawal can vary from mild, moderate, to severe. They can be very unpleasant and even dangerous. If methadone is taken, it should be monitored by a physician. Methadone overdose can produce respiratory issues, cool, clammy skin, constricted pupils, decline in blood pressure and heart rate, and even death. Methadone can reduce withdrawal symptoms and drug cravings by affecting the same opioid receptors that heroin, morphine, and other opioid prescription medications act on. But rather than treating your opioid dependency, one opioid is just being replaced with another opioid. Worse than that, those replacements can easily cause even more serious dependency, along with stronger withdrawals. Ultimately, methadone addiction should be treated at its biological root, the brain. With the ANR treatment, we can evaluate each individual and restore their own neurological and chemical balance to a pre-dependency state, effectively eliminating their withdrawals and cravings, defeating the opioid dependency from the root.